Hi, I'm Jen. I blog in mylittlebookone.blogspot.com. You might not have believed I'm already in my mid-40s. We will age, we can't deny that. But we always want to age gracefully, don't we? But who can define aging gracefully mean? To me, this is very subjective. Your definition and my definition are different. As for me, as long as my pocket allows, and I'm not too obsessed with it, I'm pretty open to aesthetic treatment to help me age gracefully. So here I am at Halley Medical Aesthetic for treatment on my forehead.
Nice to meet you again. Yeah, so anyway, I remember the last time when we met, you had some cool sculpting done.
Yeah.
So I think that's good. Now, I think you have certain other concerns, right?
True. As we age, I'm already going into my mid-40s. So lines are appearing. I cannot hide them. So I would like to do something about it.
Okay, I think that's quite a common concern. Yeah, I think lines are caused by a lot of different factors, and over different areas, I think there are different factors which cause it. So, which areas specifically are you more concerned about?
Generally, it is the forehead. Because even when I don't raise my eyebrow,
Yes.
you can see that. I mean, if I raise it, it's even more obvious.
Okay, all right, I understand. So actually, the frown, the wrinkles of the upper face are mainly caused by overactive muscles of your forehead and the muscles around your eye area. Okay, so I think that's pretty common.
Okay.
A way to treat these lines is to actually relax some of the muscles around the area.
How do we relax?
Okay, so frown lines over the upper face are generally caused by muscle movement. So muscle movement over the forehead, muscle movement around the eye area tends to cause wrinkles. So initially, when we are a little bit younger, when our skin is a bit thicker, we get what we call dynamic lines, which are lines which are caused by movement of that muscle. But as we get a little bit not so young, sometimes our skin becomes a bit thinner. And when our skin becomes a bit thinner, from dynamic lines, which are lines which are only there when we smile or when we move our face, we get this thing called static lines, which are lines which are there even when we don't smile. So a good way actually to prevent static lines from forming, and also in the meantime reduce dynamic lines such that we actually look better and younger, is to use a product which weakens the muscle. Okay? Weakens the muscle. Yeah. So I mean there are a whole host of products out there that can do it. I think the most famous is actually Botox, and a lot of us have heard of it before. But lately I've been using quite a bit of Xeomin. So Xeomin is the latest Botox type product which is out today, and I've been pretty happy to use it on quite a lot of the patients that come. Okay, so Xeomin is similar to Botox. It is a chemical that reduces the muscle activity. So when after Xeomin is injected, like let's say you're concerned with your frown lines, you would not be able to frown so much. So therefore you look younger. Number one, there's no dynamic lines. And when this is repeated over a long period of time, the lack of dynamic lines will also reduce the number of static lines that will form later on in life. Okay, do you have any questions you'd like to ask me?
There's one common myth, brother, that most people believe that after I have Botox injection, that I look stiff.
Okay.
That when I smile, I don't look exactly happy. That kind.
Okay, so I think that's true. I think these products, these medications, they are actually tools, right? And tools, as with any tools, if you use it correctly, obviously the benefits are there. But if you use it wrongly, obviously side effects can occur. And moreover, if you're going to keep the treatment just to the upper face, then obviously it probably will not affect your smile. But of course, even if you put it over the upper face, which is the three areas that we talked about, if you do it properly and you plan properly, and you have a good assessment of the situation, things like having a very stiff smile or very stiff upper face should not occur. Yeah, and even if they occur, very very rarely, even if they do occur, these results are not permanent. So far, Xeomin has not shown any permanent side effects. So even if there is, in a rare instance, you go away after. Okay, so what I'm going to do is I'm going to ask my assistant to put some numbing cream for you, and then subsequently we start maybe in about 10 minutes time.
Okay.
Is it okay?
Yes.
Alright,
Thank you.
Thank you.